There are 6, plus my own, which is unpublished. 4 papers have the same lead author, and they all range from 2017 to 2024, and I will be summarising them in consecutive date order of publication. There are also 2 other pain prevalence surveys in the public domain, and these are from 2 South African students, one who has investigated low back pain in competitive dressage riders and the other in competitive show jumping riders, 2020 and 2021. So although they are a very good source of background reading, they were in the main produced by a single author. So I'm just going to be looking at these published papers which have multiple authors. So the first, Lewis et al., 2017. Their introduction talks about acute injuries, so i.e. those from falling from a horse or being kicked or bitten, which have pain prevalence of 72 to 80% versus 33% in the general population. They state the need for strong core muscles to maintain postural stability and return to equilibrium after perturbation, and that the riders, skilled riders, dissociate between the upper and lower body, and this means that they have an independent seat, or that they can use their limbs independently of their pelvis, and that with low back pain this will reduce synchrony with the horse's movement. The aim was not only to investigate prevalence in dressage horses, but to see whether there was a negative effect on performance as perceived by riders. They had a relatively low number of respondents for a survey, but nevertheless they're drawing from a relatively small population, which was elite dressage riders. They found that 74% compete while in pain, and 37 of the competitors experienced pain while competing. So the first issue here is that not all of these papers are reporting in the same way. So whereas I have opted to confine my study to pain while riding, a number of these studies have stated pain within the last period of time, which may not necessarily be while riding. And we've also got to consider that there is respondent bias here, because all of these titles have prevalence of pain in the title. So there could well be a number of riders who are not in pain, but who may not have opted to complete the survey on the basis that they may have thought that it was not for them. So we should be cautious about the true prevalence within our sample. But the data that we can rely upon is that of those in pain, we can get a breakdown of the pain sites and the incidences of pain across the pain sites. So 62% reported that their pain was chronic, 51% self-medicated, whereas 19% were in some form of therapy for their pain, and 16% were medicated by prescription following a clinical diagnosis. Low back pain, the highest incidence was 76%, 8% for the hip, 8% for the ankle, 5% for the shoulder, and 3% for the legs. So it's not entirely specific what was meant by legs, but it could have been knee pain. 62% put the cause as the saddle, 22% the number of horses they rode, 14% reported that horse movement was the cause of their pain. And the effects of this pain were that 59% considered that this impacted on their performance in a negative way, and 55% acknowledged that their pain was distracting. 22% experienced early onset of fatigue, and 24% felt that their sitting trot position was ineffective. For the discussion and conclusion, the authors have put forward that the result is unsurprising due to cyclical loading and increased mechanical forces imposed in the vertical axis of the rider from the horse. But because this was a questionnaire, there was no objective measurement of this. They are merely assuming that this was the mechanism, although it is a strong possibility. The trunk is required to absorb large forces to remain stable, and they compare this with sailing, where low back pain is thought to be caused by stabilisation and endurance-based isometric contractions. So yes, you need a strong back for sailing and to be able to stabilise, although it is very much more a standing position rather than a standing seated position as for dressage. They cite poor endurance of hip extensor and abductor muscles in low back pain, which has been cited for a non-equestrian population, which may have impacted on their ability to maintain an effective dressage position, whereby their stability and control would have been decreased. So it's good that we're seeing some explanation, but the respondents have not reported that they believe it's due to cyclical loading and decreased stability and control. But interestingly, they have put saddle fit as a potential cause, because in all of these studies, in competitive riding, all riders use a saddle and all riders are seated astride. So they state that the riders sacrifice comfort for the well-being of their horse, and that saddle design must allow for a neutral pelvic tilt for maximising interaction while limiting pain felt. So they're suggesting that perhaps the saddles didn't facilitate optimal posture in riders that are subjected to cyclical loading and increased mechanical forces and poor endurance of the gluteal and abductor muscles. And their recommendations: we know that there are strict anti-doping laws in sport. Riders need greater access to therapy. They have a long riding career, therefore pain prevention, treatment and management is needed for this group. And they conclude that there is a need to establish cause of low back pain and to manage it. A year later, their next study was focused on event riders. They state in their introduction and background reading that riding is dangerous, that chronic pain could be the result of long-term repetitive movement, that the majority of pain was low back, and that this issue of pain affects the pool of participants. Therefore, less participants means that this could be detrimental to sport. And this will filter through to international competition performance. And that chronic pain may continue to be symptomatic when competing ceases, and this has certainly been found in racehorse jockeys. The aim was to not only investigate pain prevalence, but to locate the sites of pain, look in more detail at the factors affecting pain, following on from their first study, and determine links between pain perception and performance level. So going a step further, they want to discover whether the riders considered that this pain affected their performance. Less riders or less participants this time, 31. 96% of these event riders were in pain. They typically reported that their pain was mild to moderate. 100% of the 36 to 45 age group were in pain, progressively less for the younger competitors, considerably less for the 46 to 55 age group, and that in the 18 to 35s, this group had higher pain scores than the over 36s. So in the general population, pain tends to increase with age, but for these event riders, 36 to 45 was higher and it was lower either side of that age range. 52% experienced lower back pain, which was 76% for the elite dressage riders, less incidence in the event riders. But whereas we had 5% for the shoulder pain in dressage riders, we have 48% for the event riders, with neck pain being reported, 35%, and 32% for the upper back. So slightly different reporting here of pain sites. And we have 8% hip for elite dressage and 25% hip for event riders. But event riding has a different skill set, postural skill set or biomechanical requirement compared to dressage. 55% considered their pain affected their performance, and we have more detail here because they have compiled a pie chart which includes postural effects of limited range of motion, reduced range of motion, asymmetry. 68% attributed their pain to non-jumping riding, so riding on the flat. 35% to stable duties, 16% to saddle design, so we have the saddle coming back in again. 96%, so almost all of them were medicated, but 66% received a manual therapy. They've put the cause of pain this time to economic pressures, so of those associated with being a professional rider, such as sponsorship, and because it's their main source of income. And also that if the horse was not in pain, they could continue to ride, particularly as they don't consider themselves athletes, meaning that they didn't consider that they needed rest and rehab for their pain, even though this is commonplace for the horse. And for other athletes, I might add. They reiterate that pain was mild to moderate and that 55% considered their pain affected performance, which had physiological limitations, impacting on their position, effectiveness and balance. And this was reported by the riders this time. Then they state that position requires stabilisation and isometric contraction of the back and core muscles. So this was not stated by the respondents, but follows on from the respondents' experiences. Again, we have this repetitive strain, cyclical loading, leading to low back pain, resulting in poor endurance of hip extensors and adductors, fatigue, creating the inability to maintain position, and pain and stiffness impacting on the ability to follow the movement, the synchronization with the horse's movement, which impacts on position and effectiveness, impacting on performance. So there's certainly a biomechanical deficit here. And they state that pain above the low back may be attributed to stable duties, jumping and galloping, because there's only lower limb contact with the saddle compared with dressage. And of course, there is the impact of landing from a jump, which has to be factored in here. They cite that low back pain is due to dysfunction rather than muscular imbalance, and that the majority used over-the-counter medication. So were they undiagnosed? Possibly not, because they're in mild to moderate pain, which may not have required treatment, which did not prevent them from riding. Conclusion: pain affects position, but medication is counterproductive because of side effects. And there is a need to establish the cause of pain and manage it, which they have stated before. Again, in the same year, 2018, they now focus on horses being unpredictable and heavy, and this is for show jumpers this time. There is a greater risk of chronic low back pain due to repetitive movement and now the history of acute riding injuries. So they're bringing injury history as a causal factor. Different biomechanical demands of show jumpers compared with dressage and event riders, yes. So you may expect different prevalence and different pain sites. And they wanted to determine the pain location and the factors affecting pain and whether that impacted on performance. 80 participants this time, and again it's another survey. All of these studies were surveys, qualitative, retrospective questionnaires. 89% female, of which 70% were amateur competitive, and this group was 1.42 times more likely to be in pain than not. 85% was found to be neck and back pain, and again the majority was in the low back. The knee was the most common this time and typically mild, but hip and upper back pain was moderate. They had been in pain for 3+ years. Only 15% diagnosed medically, and 70% managed their pain independently of medical care. 47%, almost half, used a manipulative therapy, which is less than for the eventers at 66%, although they are more specific here because it's a manipulative therapy. And 25% used an exercise program. There was no association between age and pain, which is what we find in the general population, but there was a highly significant association between years of riding and pain. 85% believed their pain to negatively impact on performance. But I'm sensing here that these riders overall, if they're medicating themselves and they know that their pain is negatively impacting on their performance, and more than half of them are seeking therapy for their pain, postural therapy, they don't seem to be resolving the problem. Although the study that I carried out questioned whether their pain was changing. Was it improving? Was it deteriorating? Was that slowly? Was that rapidly? 45% believed their postural symmetry was affected. 36% believed that their range of motion caused fatigue. Discussion: at 61%, pain is less prevalent in show jumpers compared with elite dressage and event riders. Again, they cite the cause of pain as the cyclic nature of riding, damaging the soft tissue, and impacting on postural control while riding. And I think the more equitation science evolves, and the science of posture and low back pain, the more we can start piecing this information together and becoming more detailed and specific. Show jumping involves a great deal of body segment control, as they open and close the angles of the hip and knee, to deal with acceleration forces from the horse, particularly on landing. So imagine the rider has to brace themselves for landing, and how much of a body shock this can be. And this would be dependent on how much they could absorb through their ankles and knees, which would in turn reduce the shock from higher up. The restriction in range of motion affects the position over a fence and horse performance. Yes. Pain affects concentration, which affects memory. So for this group, they rely on their memories to accurately follow a course of jumps and position the horse's approach to jumps. So it's fairly technical getting a horse around a course of jumps, varying in type and height and depth, and while processing a wide range of variables such as speed, straightness, quality of gait, fence type and height for optimal takeoff. So the more technical the course, the more psychologically demanding it is, as well as physically. And they state that self-medicating and over-reliance on pain medication carries a risk of side effects and non-compliance with anti-doping regulations. So this is an issue here because we have groups of competitive riders in different disciplines with large numbers of them admitting to using pain medications, probably so that they can continue to ride instead of rest and rehabilitation. So that is concerning. Conclusion: pain in show jumpers affects posture while riding. Again, for the third time, the need to establish the cause of pain and manage it. So we're very much getting the message here that there is a substantial rider welfare concern here. Different researcher, 2021, Ferranti et al., and they talk about, in their introduction, the relationship between low back pain and physical activity and its role in treatment being generally accepted, on the basis that physical activity is both preventive and a risk factor. So what they're implying here is that exercise can prevent injury, but it's also a risk factor for injury. There are performance limitations for athletes with low back pain. Chronic low back pain is prevalent in athletes. It's high in equestrians and accepted as a physiological consequence of the sport. They put forward that the highest forces are absorbed through the seat bones, the pelvis, the sacrum, and the lumbar spine, which is the lumbopelvic complex, potentially contributing to low back pain. And again, they bring in the saddle, so that using an inappropriate saddle is a risk factor, but links between intensity, discipline and frequency or severity of back pain has not been found. So these are suggesting that the saddle may be a problem because the disciplines the riders engage in is not linked with the frequency or severity of back pain. So in addition to looking at the prevalence in low back pain in their population of Italian equestrian athletes, they investigated which equestrian disciplines are associated with higher prevalence of low back pain and how training and competition levels affect prevalence. So again, searching for more specific risk factors for low back pain in equestrians. They wanted to see if there was a link between chronic low back pain and training and disciplines, and they wanted to identify associated factors for the purposes of developing preventive strategies in this special risk sport group. They had a much larger number of respondents compared with the previous 3 studies, which ranged between 31 to 80. Again, high number of females, 78.1%. Their respondents were average age 33.2 years and varied 13.3 years either way, who had an average of 16 years of practice, varying from 10 to 25 years, and a median 5.5 hours, ranging from 3.5 to 9 hours training per week. 35%, so a third of this group, followed a training plan for equestrian sport. 91.6 had a low back pain lifetime prevalence, and 74% lifetime to a year. 61% were show jumpers, 13.6 were dressage, 6.3 eventing, and 2.9 country riding, which I assume to be leisure. And they found a strong positive association with weight and low back pain. They found age to be protective of back pain, and 62.8% used medication to control low back pain. So again, we're getting high numbers of riders self-medicating. They also found that 5.6 hours a week of riding correlates with chronic low back pain, and they state the odds ratio for this, which is almost the same for 1 to 2 hours per week, but rising to 3.27, which is fairly modest, for 13 to 18 hours. So a big jump in number of hours per week, but without a corresponding increase in the odds. There was a significantly weak association with training volume, and again reported that chronic low back pain affects performance. And what they did is that for those riders who experienced chronic low back pain in the last 3 months or more, they went on to complete a pain self-efficacy questionnaire. For my questionnaire, they all completed it if they stated that they had pain across a wide range of locations or sites. Their discussion: low back pain is common and higher than the general population in this group, but they highlight the difficulties in making comparisons because different studies have different definitions of low back pain. And if you recall what I said earlier, for my study, I wanted to know about riders who were in pain while they were riding, but other studies defined low back pain as having experience of low back pain in the previous 12 months. So it was not possible to compare prevalence data between equestrians and other sport because of methodological heterogeneity. So yes, they've pointed out some limitations here because you cannot compare one study with another if they are methodologically different. So they would have to use the same questionnaires, for example, in order for them to be comparable. But again, that's not to say that you can't get a lot of useful information, because pain should be binary. Either you have low back pain or you don't have it, but the degrees of it can vary, although that can be highly subjective too. So this is of concern that they found out that the prevalence of low back pain in younger athletes is rising, but remains lower in adults, that age is protective, but the young are more at risk. But did they include younger athletes? Yeah, I can only see that their athletes were age 20 at the youngest. So they make a statement about low back pain in younger athletes, which they've obviously cited from a study already out there, that it doesn't necessarily link with their results, or that it wasn't found by them, but they didn't actually question younger athletes. But they make a very good point that age is protective, but the young are more at risk because the training sessions of younger athletes are more intense, and older athletes have better technical competence that can decrease spinal load while riding. And they acknowledge that this requires confirmation in future studies. But it's a very good point to make, and it's logical and it's plausible. Unlike other sports, training volume was not linked with low back pain, indicating that sport-specific differences might, because of the differing spinal loading. So what they're saying is you might expect that for equestrians, the more hours, the more training sessions, the more likely they would be to experience low back pain, as is found in other sports. So what is it about equestrian sports that does not conform to this trend? Chronic low back pain has no correlation with gender, age, weight, discipline or competition level. Chronic low back pain was linked with psychosocial factors, which means in that no correlation between pain severity and self-efficacy, so how they psychologically view The injury is not just traumatic. Again, they come back to this repetitive movements over long periods of time, causing overuse musculoskeletal injury. So being more specific about overuse as a pain factor, which can reduce physical performance and participation. Previous injury can affect asymmetry, balance and performance, and poor posture and an inactive core may cause pain at some point, if not actively trained and rehabilitated. So these guidelines are coming in now in the introduction to the paper as the background. Repetitive injuries cause back pain earlier in life, and the 35-year plus represent the highest prevalence. So remember before that I stated that in the general population, pain increases with age. In the equestrian population in the UK, this researcher's work has found the 35-year and older to be the problem group, and that there's been minimal research on this group of non-elite and leisure riders. So having completed studies on elite competitive riders in dressage, show jumping and eventing, they're now looking at a wider range of riders because they've identified a need to establish how pain affects riders as they age, to establish common rider injuries, prevention, similar to the previous research team, treatment and pain management strategies. So all now identifying that there is a need to deal with rider pain in some way because the self-medicating is not quite hitting the spot. So as well as investigating prevalence, they're looking at the site, the pain severity and pain factors and management techniques in the over 35s. Comparatively very large cohort, 2,185, but I couldn't see that these were entirely UK based because of their method of distribution of their survey. 98% female, with an odds ratio of 1.28, more likely to have experienced pain in the last 2 years. 31% were in the 35 to 40 year category. So they've stated that the riding longevity can span many decades, but a third of their riders were between 35 and 40. 83% experienced chronic pain, and the highest being in the 61 to 65 year group, and the 35 to 40 being the least. 51.9 focused in the low back, which was comparable, almost the same figure for event riders. Head was the least common site of pain, which I found in my study, although the number of respondents reporting head pain was very low. 54% had pain for over 6 years. 83% had been riding for more than 20 years. 49% were amateur and 43% recreational. But what I noticed looking at these results, the range was only 10%. So, for example, a rider riding less than a year compared with those riding more than 20 years, there was only a 10% difference in the incidences of pain. 72.8% were made worse by stable duties. So 3/4 of them believed that their pain was exacerbated by having to do these associated stable duties. So that's quite a lot. So now putting in a link between having to perform those asymmetric stable duties of carrying water buckets, of mucking out and sweeping the yard, beginning to be seen as having an effect on their pain. and this was similarly high across the levels of competitive participation. 30% considered that their pain causes fatigue. 41% considered that their pain limits movement. 46% for decreasing range of motion. 41% for causing asymmetry. 17% recognised that their pain caused horse asymmetry. And 42% had to give up riding due to pain, and this ranged from days to 15 years. So is this as a result of 30% prevalence being present in the population anyway? Or what is it about their pain that so many of them attributed to riding? It's difficult to get some answers here. 36%, just over a third of them participated in other exercise or sport for 2 hours weekly. And for them, they were 1.4 times more likely to suffer pain. And the odds ratio for those who only rode and did not participate in other exercise or sport, they were 1.4 times more likely to suffer pain. So what they're suggesting here is that participating in another physical activity was somewhat protective of developing pain. And they included a table of odds ratios across disciplines ranging from 3.5 to 11. So their discussion conclusions focused on pain features and characteristics. Individual perceptions of pain could have influenced the data, so that determination of more accurate results are needed. So what they're bringing into their argument here is that those pain questionnaires were potentially not representative of true levels of pain, but without objective measures, how can we be sure that pain reporting is reliable? So they want to see more accuracy, but my view is that pain is pain. It's still distracting. It still triggers compensations or postural compensations. And that I don't think we need to be so concerned with numbers, although we do if we're comparing studies. But I think we need to be more concerned about rider welfare generally and about individual riders. If they say they're in pain, then they probably are. Even though some may report a higher level of pain than another, does that or how much does that affect their pain experience? In any case, it's likely to still affect their equitation posture. They cite a cause of pain as stable duties. Again, repetitive asymmetric movements over many years. Recall that we've heard that the longevity of equestrian activities can occur over several decades, and that their respondents reported this as a common cause of chronic pain, which was 72.8%, and that pain and age in equestrians is likely to be functional and related to muscular imbalance. So again, we've got asymmetric cyclical loading over many years affecting functional movement rather than increasing joint pathologies. Hip rotation. It's interesting that they've brought this in. And I think as researchers bring different researchers onto the team, and as equitation research evolves, we get different perspectives on the outcome of the results. Hip rotation relates to low back pain and reduced range of motion, both active and passive. Think about the rider seated in a saddle and the horse's movement generating passive hip joint movement in the rider, and greater asymmetry in hip rotation mobility. And this is important. External forces sequentially transmitted from distal body segments to more proximal during movement, i.e. hip movement, therefore influences movement at the lumbar spine. Performed repeatedly, excessive loading on low back tissues leads to low back pain. Now they're bringing in gender and pelvic morphology and state that gender differences in hip and lumbopelvic rotation patterns may explain the higher levels reported in females. And this is where the discussion gets into the differences, the fundamental differences between the male and female pelvis in terms of the siting of the acetabulum, where the femur joins the pelvis, which is more lateral in males. And we can get into the discussion of potentially why saddle seat fit is less of an issue for males than it is for females who have more anteriorly sited hip joint sockets, which predisposes them to a chair seat, compared with males whose hip joint sockets are sited more laterally, therefore allowing the leg to hang down more rather than forwards. And over-the-counter medications are the most common form of treatment and could affect proprioception for split-second decision-making. So they really are making a case for why horse riders are at risk for being in pain and taking medication for it without following the conventional or usual rehabilitation strategies. And these reduced functions could impact on horse welfare by inducing conflict behaviours. So in other words, if the rider's judgments are impaired, it's going to affect the horse. Limitations are stated that individual perception is likely to determine the impact of pain and limits reliability of results. Yes, we've stated that already. So that different individuals are likely to state their different individual experiences of pain, which may not be comparable to others. Conclusion, and this is important, effectiveness of pain prevention and management is debatable due to the high number still experiencing pain, which I stated earlier that these rider pain strategies may not, in the main, be effective. Attitudes of riders to their personal health is of concern to the equestrian industry. Future studies should be quantitative as well as qualitative. In other words, perhaps they need to be measuring posture in person rather than just surveying riders, to provide us with more in-depth knowledge. So to really get to the root of the problem of what's not working for riders. Further research is required on causes of pain, injury diagnosis, treatment and prevention to improve awareness of rider welfare. So this is where this all opens out into we need to be focusing our attention not just on horse welfare, which of course is paramount, but we do need to recognise that there's also a rider welfare issue on a number of levels, such as self-medicating, not entirely making progress with it, contravening anti-doping guidelines, impacting on their proprioception and decision-making. Yet these riders feel compelled to continue to ride while in pain. Next, Duarte et al. 2024, low back pain prevalence in Portuguese riders. So these are focusing on the low back pain, which we know has the highest incidence in equestrians. Their introduction and background. Equestrian sports science is an emerging field. Yes. Recall that the studies that I'm analysing are all of the peer-reviewed studies out there to date, focusing on pain prevalence in equestrians, but it's often based on experiential learning and tradition, the art of riding rather than the science, instead of scientific knowledge. It's predominantly focused on the horse, as I just said, but for the rider, only for the past 2 decades. They mention this long career of riding, with children starting at 5 and Olympian riders riding at 60 or 70 years old. It's hazardous. It requires precision postural alignment, neutral pelvis, controlled upright trunk adapting to the horse's movements, which is achieved by coordination of the centre of balance between horse and rider. Now, don't you think that's got something to do with the saddle? Which reduces risk of falling. Substantial and repetitive compressive mechanical forces are primarily absorbed by the rider's vertical axis, notably the lumbopelvic hip complex. Repetitive nature of training places significant demands on the musculoskeletal system, leading to muscle tightness. Coordination dynamics are linked to rider postural control and reliant on coordination and neuromuscular awareness of core and back muscles. So very much they are focusing their spotlight on rider biomechanics. Again, we have overuse and chronic injuries due to cyclical movement, not just impact of, for example, falling off and hitting the ground. Poor posture may lead to pain. Yes, I think that's well established now. And rider overcompensating can cause horse training difficulties and discomfort. Yes, so it upsets the horse. And riders continue despite injury and pain. Yes, they do. That's been established in the science. And repetitive movement patterns can cause overuse injury, risk of spinal instability, leading to back pain. So I think they're really trying to hammer it home now, and they've built on the previous research. And importantly, physical activity can be both preventive and predictive of low back pain. That's been stated earlier, so that exercise can be good for you, but it can also be bad for you musculoskeletally, which affects many riders and is the most common equestrian injury, with higher incidence in equestrians compared with athletes, so other athletes, or the general population. So they're really starting to make a case for the severity of this issue. Equestrians with low back pain can be distracted. That's been stated earlier. There's a higher risk of falling due to earlier onset of fatigue. The tired rider is at higher risk of injury from falls, as well as soft tissue strain. And this low back pain resulting in reduced ability to maintain optimal position and synchrony. And they aim to, as well as look at prevalence, gain an insight into the primary factors or possible causes in this population. So we still don't know the cause yet. There have been many proposed causes, but the jury is still out. They had 347 respondents to their questionnaire. 40.1% were show jumpers, 22.8% dressage, and 21.9% general riders from Portugal. 58.8% were female, so they had a bit more balanced sample than previous studies where females predominated. Males were older, taller, heavier, with higher BMI, although they were still in the normal range. 67.1% had a 12-month prevalence of low back pain. So again, as I stated earlier, yes, they had back pain or had experienced back pain, but was this while riding? Higher with increased weekly riding workload in professionals who also performed stable duties. So getting even more specific now, that these stable duties were more of an issue for professionals. And this was higher in females. Notably, there was no association between discipline and low back pain. So in other words, whatever the discipline, there was no link between that discipline and the incidences of low back pain. Higher prevalence in younger riders up to 35 years. Again, recall that we would expect increasing prevalence as riders aged. In agreement with Lewis et al. 2023, higher prevalence in younger riders up to 35 years, whereas Lewis et al. 2023 found this to be higher in the 35 years and over. But the pattern they found was that it was lower in the 36 to 45s, then higher in the 46 to 55s. So there is not a linear pattern to this pain prevalence. Highest prevalence in women aged 26 to 35 in the past 12 months, or in those who had experienced low back pain in the last 12 months. Higher in the 7+ hours weekly professional riders and those engaging in stable duties. No difference in those engaging in other exercise or who warm up before riding. So that's a surprise for me, because I've always thought that warming up would be protective for joint pain, but there's something else at play here. So I'm pleased to see that this has been investigated. Dysfunction was not linked to BMI, body mass index, body weight, or years of equestrian experience. And 63.1% believe pain impaired performance. So now we have the riders again saying that my pain is impacting on my performance. Professionals are more likely to be dysfunctional due to pain. But then, are they dysfunctional because of their stable duties, in addition to riding professionally? And age and increased body weight contributed to dysfunctional status. So these are bringing in body weight now as a causal factor. So let's go for the discussion. In this paper, they largely reiterated the results. They concluded that the probability of low back pain increased with higher workload and in professional riders who performed parallel duties. So they asked the question about these parallel stable duties, but other studies did not find a link between the higher workload and professional riders and back pain. Low back pain impairs performance, is aggravated while riding. Again, in my survey, I wanted to determine the prevalence of pain while riding, whereas in this study, they've inquired if the pain is aggravated while riding, but it's still an important question, and when performing the parallel duties. So getting more knowledge and information about the nature of the pain. Professional riders score higher on dysfunction in their activities of daily living. There could be a number of reasons for this, but it's worrying that professional riders' pain is associated with increased dysfunction in their activities of daily living, such as sitting, standing, walking, travelling, socialising, and so on. Off the yard, in other words. And just to point out that in other professions, health and safety exists to prevent injury at work. So why isn't this happening for horse riders? They recommend that future studies should be conducted on pain measurement of low back pain in equine athletes and the effects of appropriate nutrition counselling and specific physical training. So they want to get them in shape to reduce pain, which they believe will improve performance and well-being. So yeah, that's an aspect of it. But still, these studies have alluded to saddle fit for the rider, but my study, which I will come to now, asked some very specific questions about the saddle. So not just, do you think your saddle's causing your pain? I've included a number of questions, for example, about saddle comfort, whether the saddle was rigid tree, flexible tree, whether the saddle was professionally fitted or not, what type of saddle they had, and the width of the saddle. And I'm looking at rider posture, pain and performance, but step one of that process was to determine the pain prevalence in horse riders and the sites of pain. And I had female questions such as their maternal status, so that I could investigate any links between childbirth and soft tissue injury and saddle comfort, and the presence of pain in the perineal region, in the pelvic floor region. So I've taken all this research, previous research, a step further, because I recognised that there was something going on here, that we needed more variables to add to the research, which would perhaps generate more possible or potential causes. So again, the title of my questionnaire included pain and prevalence in riders, so there could have been responder bias, so that we have more riders in pain within the cohort than is perhaps representative of the population. But at least we can get prevalence within prevalence with this method, because we really do want to attract the riders that are in pain. So I confined my research to UK horse riders, and I also ran 2 pain questionnaires to establish links between pain and the impact on daily living, as was done in the previous study, which made links between professional riders' pain, stable duties, and dysfunction in activities of daily living. But I also wanted to establish any links with saddle construction and fit, because my 25 years of professional experience lies in the 3 elements of the horse-saddle rider combination. That's horse and rider therapy and saddle fit checking. Descriptive results. As yet, I'm just finalising my background and introduction to this study, so that's for a later date, but it will focus on pain and posture, postural deviation, seated sport, and equitation technique. I had 940 respondents, which made for a reliable study. Again, my study had a high number of females participating or responding, 98%. 39% of those had given birth, and 81% of those who had given birth experienced soft tissue injury. So that may have been in the perineal region, or it may have been as a result of caesarean section, because we have to consider that in the surgical option, the anterior abdominal core muscle is sectioned, which could have an effect on lumbopelvic stability. 70% began riding under the age of 12, with 98% of respondents beginning to ride under the age of 19. 40% were competing, and 54% of those at novice level. 52% were riding only one horse. 71% of all respondents rode between 3 and 5 days per week, with 64% riding for between 45 minutes to an hour. 84% of those respondents declared that they were in pain. 53% of those in pain stated that their pain was in the low back. which corresponds with the Lewis study, event riders, and in their over 35s. But there was different reporting for their show jumpers. 45% for the pelvis, which was hip joint and perineum. Perineum making up 15% of pain cited in the pelvic floor. 37% for the knee and 26% for the ankle. And this made up 75% of total incidences. Now, I asked how many pain sites they experienced pain in, and surprisingly, 26% reported pain in one site, but 32%, which were the highest incidences, reported pain in 2 sites, and so on for the 10 sites that my survey was based on. Pain was typically moderate, intermittent, and did not change over time across all sites, except in the ankle. Mild pain had the most incidence, and the head. And the saddle questions, 56% rated the comfort of their saddle of 5 or less, which was surprising considering how much of an investment a saddle can be. So this suggested to me that there were a large number of riders who were dissatisfied with their saddle. When I asked had they had their saddles professionally fitted, 58% of them had, but I did recognise that there were riders who rode multiple horses or who shared a horse and who had a saddle that was fitted for another rider, or a saddle which was used on a number of horses. But again, a proportion of those saddles were fitted to the rider. It just happened to be that they also fitted a range of horses also. 70% of my cohort rode in saddles with a rigid tree, and the pain intensity while riding was 4.7 for the low back, 5.2 for the pelvis, 4.7 for the knee, and 4 for the ankle. And this pain was more likely to be reported as sensory than affective. So, for example, they reported a characteristic of the pain, such as burning, aching, shooting, rather than how it affected them, such as punishing, cruel. But I was more interested in the intensity of the pain rather than the characteristic. Both my surveys, within my survey, were validated, and the second survey within my survey was specifically for low back pain, although I used it for my respondents to report all sites of pain. They reported that there was only mild to moderate impact on their activities of daily living or off the horse. Then there was a second level inferential phase of testing the data set, and the results could be split into protective or predictive, and this is where the saddle could be associated with pain. So I'm in the process of writing up the discussion for that, and because these inferential results are loaded towards saddle construction and design, I will be commenting on that as a potential cause of pain in the discussion and making my recommendations very much in line with the other studies which advocate that we need to take a look at rider welfare. To summarise, these research papers represent an evolution of the equestrian science on rider welfare and show how the background, discussions and conclusions on this topic have been expanded from 2017 to the present day. Introductions across the articles cited acute injury, repetitive movement, the longevity of a riding career, the effects of pain on rider performance, the biomechanics and demands of riding, and the incidence of rider pain compared to other sports and the general population. Postural control, asymmetry, saddle type, rider distraction, fatigue, and an inability to maintain optimal position are also cited. Results: these predominantly focus on low back pain affecting rider performance. Riding demographics such as frequency, intensity, and duration of riding sessions did not have as much of an influence on rider pain as would have been expected, but stable duties and the saddle did. Pain was typically reported as mild to moderate, and my own study found that pain levels typically remained unchanged over time. Pain had a negative effect on posture and performance, and self-medication was the main treatment modality. Discussions. Overall, equestrian science is expanding rather than narrowing the search for causal factors, and there is still more work to be done to establish tangible risk factors that impact on rider posture and pain. Most researchers concluded that rider pain should be further investigated so that it could be treated and/or managed to improve their welfare. Putting this all into context, pain is already endemic in the general population. My survey inquired about pain while riding, and this returned a pain site prevalence of approximately 75% attributed to the lower body, which strongly leads to the saddle as a causal factor, notwithstanding that many riders also perform asymmetric stable duties. In my study, saddle comfort was reported as scoring only 5 out of 10 or less by more than half of the riders, with about the same number being professionally fitted. The big picture is that what the vast majority of riders in all of these studies all have in common is that they are seated astride a moving surface with a saddle mediating between the two. Rider posture and saddle ergonomics are therefore direct causal factors that should be further investigated and addressed so as to improve the musculoskeletal health of the rider, to reduce their reliance on medication, which does not appear to be helping with rider pain pathology in the longer term.